Welcome everyone to our webinar hosted by Neuropraxis, and we're going to cover occupational therapy's role in supporting traumatic brain injury caregiver well-being. Okay, so at this time, we kindly ask that you complete this first survey to measure your baseline knowledge of the topics covered in this webinar. It should take no longer than 1 minute to complete, and if you already completed it, please disregard and thank you for your assistance. All right, so we're going to go ahead and get started. So we created this webinar to increase your awareness of healthcare services that can assist in a brain injury recovery and support your well-being as a caregiver. We aim to improve your confidence in advocating for healthcare services that can improve your and your loved one's health, provide you with information on how and why occupational therapists work with caregivers, and an opportunity to ask us occupational therapy related questions at the end of this webinar. So as a disclaimer, the following materials is for information and support only. It is not a substitute for your or your loved ones or your doctor's health advice. So this webinar was created by me, Vanessa Rivera, an occupational therapy doctorate student from West Coast University Center for Graduate Studies, in collaboration with Neuropraxis, a home and community brain and spinal cord injury rehab company, as a means to fulfill my doctoral capstone project's purpose in providing accessible resources to support the well-being of caregivers in the brain injury community. Under the supervision of Christine Weaver, the founder and CEO of Neuropraxis and an occupational therapist with over 29 years of experience in brain injury rehab. So after this webinar, you will have an understanding of occupational therapy's role in traumatic brain injury recovery, how occupational therapists collaborate with caregivers in achieving health outcomes for you and your loved one, what current research has to say about the benefits of occupational therapy, and how you and your loved one can receive OT services. So occupational therapists, or OT for short, are licensed healthcare professionals who are trained to treat a variety of injuries, impaired abilities, or illnesses for individuals of all ages. OT uses a comprehensive whole person approach to rehabilitation. This gives us the unique ability to treat not only the physical symptoms, but the psychological, social, or environmental aspects. Within brain injury rehab, OTs use a variety of methods to increase brain injury survivors' performance and independence in their daily life. This can look like training and memory strategies to return to college or work, behavior management, travel training so survivors can access their community and go to supermarkets, or even return to the gym. And OTs also provide education for caregivers and families, but this is just a snapshot of what OTs can do. We're going to go in depth in this webinar. So our name may be confusing as occupations are associated with the job. However, OTs describe occupations as everyday activities that we occupy our time with and brings us meaning and purpose as individuals. And it also includes the roles we take on in our families and our communities. Roles entail being a wife, a college student, a business owner, or a high school athlete, among many others. As mentioned, occupations are what we fill our time with. We have provided a visual representation of what occupations may entail. You might recognize them as establishing and maintaining romantic or platonic relationships, giving and receiving affection, and even providing care for a spouse who's recovering from a brain injury. Planning, preparing, and serving healthy meals for yourself and your family, and even it entails cleaning up afterwards. It also includes planning and getting around your community for any purpose via car, rideshare, bus, taking the train, riding a bike, walking, and even getting in and out of your vehicle, or any type of vehicle for that matter. Your daily routine of brushing your teeth, showering, putting on makeup, styling your hair, or even shaving are all considered occupations. And it includes socializing and communicating with others within a group and communicating via phone or augmented communication devices. And my favorite, rest and relaxation, and even preparing to sleep and participating in sleep are all considered occupation. All right, so as a recap of what we covered so far, OT services are focused in supporting our clients' independence in their environment and the community. We improve function to support participation in occupations that matter to our clients. We also provide training in adaptation, which entails changing the structure of an activity to achieve success without changing the outcome. For example, training in using visual checklists and labeling kitchen cupboards so your loved one is able to cook for themselves following a brain injury. And it even entails more advanced levels of adaptation. So now we're going to go over the outcomes that you can achieve through OT services. So OT services, their outcomes are dependent on your or your loved one's personal factors, the environment you live in, the setting OT services are provided, and even the type of insurance coverage. So presented here are outcomes provided in the OT scope of practice that caregivers or brain injury survivors may achieve. We also provided specific examples of what these outcomes may look like within the brain injury recovery. So occupational performance is the act of doing an activity or occupation. And this can look like being able to shower independently or return to work following a brain injury. This is due to improvement in performing a task by adapting the shower with the shower bench or enhancement in time management and higher level cognition following several OT sessions. Prevention of negative health effects of caregiver burnout through education on maintaining self-care practices and preventing physical injury for caregivers in the community. Improve health and wellness by providing training to brain injury survivors in appropriate social skills and anger management techniques to maintain their social circle and family relationships. Improve quality of life through caregiver training and coping strategies for brain injury-related behaviors and how to process ambiguous thoughts following their loved one's injury. Participation in desired occupations like your loved one being able to return to playing basketball after improving their endurance and eye-hand coordination in their OT sessions. Achieving role competence through training and self-advocacy for requesting accommodations at work, so your wife who recovered from a brain injury is able to meet her job role requirements. Improve well-being for caregivers who attend a brain injury support group led by occupational therapists by connecting with other caregivers with similar experiences. And occupational justice can look like a brain injury survivor joining their state advisory board following OT training focused in self-advocacy, executive function, and emotional control. So what are the requirements to become an occupational therapist? So this will be very brief as it's just a general overview. So occupational therapists are required to have a doctorate or master's degree from a graduate program accredited by the Accreditation Council of Occupational Therapy Education. They must pass intensive education and training in human function, adaptation training, intervention planning, the evaluation process, discharge planning, and how to implement standardized assessments. OT education prepares practitioners to address a variety of diagnoses across the human lifespan. Every OT must pass 2 12-week rotations in 2 different settings, such as physical rehab, community-based services, pediatrics, and others. This is where the students acquire real-life application of OT education and must show clinical skills and knowledge in order to practice in the OT field. And for those receiving their doctorate, they must complete a doctoral capstone experience of 14 weeks of full-time supervised professional OT work done in the community. OTs must pass NBCOT exam to achieve their state licensure. And after receiving their state license, they can achieve advanced training in a specialty of their choice, such as becoming a certified brain injury specialist or certified neurospecialist to improve their clinical skills in serving the brain injury community, but this is not a requirement. So now we'll go over how OT can help caregivers such as parents, family members, or friends involved in the care of somebody recovering from a brain injury. Physical rehab is often focused in improving the survivor's health outcomes. However, OT are also trained to address the needs of caregivers following your loved one's brain injury. So OTs can and have provided skill-building coaching and education interventions for caregivers. They can cover the following areas: problem-solving techniques for both the survivor and caregiver, caregiver stress management, communication techniques to avoid and manage conflict, active coping skills, identifying and addressing marital needs, emotional awareness, positive behavior strategies, empathetic reflection, self-care implementation for caregivers, self-advocacy in accessing services, strategies to ensure consistent medication adherence, key insight into your loved one's recovery, education how to support your loved one as an active participant in their care, and even how to set goals for your loved one to help them return to previous roles. The list will go on and will vary depending on your and your loved one's specific situation. So these OT interventions can be provided as early as the acute inpatient phase to the outpatient phase of recovery. Where they take place and their frequency are dependent on the type of insurance coverage, the setting you receive care, and availability. They can include in-person one-on-one sessions with you and your loved one, or face-to-face group interventions with survivors and their caregivers. They can also occur online via telehealth sessions for individual or group sessions, and these online interventions provide the benefit of time efficiency for those who live far away from OT services. They can also be provided in a hybrid approach of both online and in person to help meet your availability and accommodations. And these interventions can also be provided through OT-led support groups dedicated for TBI survivors, families, or caregivers. Neuropraxis has provided an online support group for caregivers to support their knowledge of the brain injury recovery process and acquire knowledge of tools that can support their well-being as they care for their loved one. So we have actually provided information at the end of this webinar of these resources. So we will go over what the current research has to say of how occupational therapists can meet the needs of caregivers and brain injury survivors. Caregivers play a key role in brain injury recovery, and OTs understand the importance of caregiver collaboration and are trained in working with family caregivers to not only improve survivor health outcomes, but to support caregiver well-being. Research emphasizes the importance of collaboration between family members and healthcare professionals. Specifically, it has been found that brain injury survivors who receive care from caregivers with high reported caregiver burden demonstrated high impairment in their neuropsychological functioning. Ethnic minority caregivers are at a heightened risk of caregiver burden, and this can be due to a variety of factors, such as disparities of being unable to access supportive services, or even placing their own personal needs behind their family's well-being. So OT is distinctively prepared to support caregiver well-being through interventions rooted in prevention of negative effects of caregiver burden and promotion in caregiver self-care practices. So several studies have found that OT services can improve caregiver use of healthy habits and routines, stress management, and improve caregiver self-confidence in managing daily stressors. Specifically, several studies conducted in 2022 found OT interventions that included both the caregiver and brain injury survivor shown a significant improvement in their relationship satisfaction, communication, and marital adjustment. A study conducted in 2015 with the 153 TBI caregivers who participated in an OT program for over 6 months reported increased quality of life, emotional well-being, improved ability to get support from family, friends, and their healthcare providers, and even improved their ability to care for their own health by consistently applying coping strategies for caregiver life stressors. Another study conducted in 2022 revealed that an OT online program that addressed compassion fatigue, burnout, and secondary traumatic stress led to improvement in caregiver ability to detect, monitor, and implement strategies to cope with traumatic stress following their loved one's injury. And a quick fact, so a study published in 2016 revealed OT services can lower readmission rates due to the profession's unique focus on clients' functional and social needs, while also providing training for caregivers and their collaboration with other healthcare professionals. These OT-addressed areas are important, as left unaddressed can lead to hospital readmission. So now we will learn how you can get OT services for you and your loved one. So in order to receive OT services, you will need a doctor's referral. The second is insurance coverage. It can either be private or government-based plans. And most insurance companies cover these services, but we recommend asking your loved one's insurance company if they cover OT services. And once a referral is submitted and you found an OT that will work with you, the process begins with consultation and screening to assess the appropriateness of services. And once appropriateness is determined, then the OT will complete a comprehensive evaluation with standardized assessments, along with a comprehensive interview with the brain injury survivor and their caregiver. This evaluation process is used to gather information about specific areas that can be addressed in session. The OT will collaborate with the survivor and the caregivers to create a treatment plan to fit their needs and goals with the set number of approved sessions. These interventions can take place either in your home, outpatient clinic, or within a hospital. Following treatment, OTs will collaborate with survivors and their caregivers on assessing progress and determine if services are appropriate to continue. And if goals are met and their progress is actually measured through standardized assessment, then the survivor can be discharged from OT services. So OT services are typically covered under most health insurance policies. However, the length, reasoning, and method of receiving OT services vary. You can ask your loved one's insurance company if services are covered, they have session limits, what is their pre-approval process, and if you have to pay copay or co-insurance charges per visit, and what are your choices in appealing for OT services. However, you do have the opportunity to pay out of pocket as well. So you can look up OT services in your area via Google or Yelp, or you can ask other caregivers of OT they had great experiences with in the past during their loved one's recovery. You can also advocate during your loved one's doctor's visits by working together with your loved one and listing the concerns regarding the recovery and asking the doctor if they believe OT services would benefit them at this point. You can also email your loved one's doctor's team with these concerns. Also, you can mention these requests to your loved one's physical therapist or speech therapist. And most importantly, case managers serve as patient advocates to coordinate care for their clients. So working together with your loved one's case manager can help navigate the process of getting OT services. So in the following slides, I will provide you helpful resources that can support you during your caregiver experience, but the following resources are not under ownership, endorsement, or association with Neuropraxis. So it's important to know your legal employment rights as a caregiver to ensure your rights are being upheld as you request time off from work. Provided here are California state-specific acts and bills, and if you have questions or concerns regarding your rights, you can contact the Legal Aid at Work helpline for caregivers, and they offer their services in a variety of languages. The Caregiver Resource Center offers a variety of supportive services for caregivers in navigating healthcare services for their loved one and for themselves at little to no cost. CareNav provides personalized help in navigating the healthcare system for each caregiver's unique situation. And Protected Tomorrows provides free step-by-step tutorials on how to apply and maintain government benefits for your loved one. So these services can provide you insight of the specific programs or services you or your loved one may benefit from. They offer free counseling on the application process of these programs or education and training on your loved one's rights under the Americans with Disability Act. You have the right to apply for your loved one's hospital's charity care policy to cover partial or full costs of their medical expenses. However, each hospital's income requirements vary, and Help Hope Live is a nonprofit that provides training and opportunities to fundraise to help cover your loved one's medical expenses. IHSS can help pay for home care services for individuals, including children, adults, or older adults who meet the following criteria: those who are 65 years of age and older, disabled, or who are blind, a California resident with medical eligibility, or who lives at home. Needy Meds is a nonprofit who connects you with resources that can cover the cost of medication and healthcare services. You have the right to appeal insurance decisions and have a third party review it. So these two websites actually provide step-by-step information on how to start the health insurance appeal process. And it also provides you state-specific information according to your state's healthcare policies. Family Caregiver Alliance provides information and counseling on accessing local respite care services. The California Respite Care website serves the Southern California region in connecting parents or caregivers to respite care services for their child who lives with a disability. And the Arch National Respite Network provides a nationwide locator of respite care providers. And as mentioned, Neuropractice has created 6 modules to support brain injury-based caregivers to learn about the brain injury process, provide tools to support your well-being, and how to support your loved one at home. You can access these modules on Neuropractice website or on the Neuropractice YouTube page. And as an overview, occupational therapists are allied health professionals who treat not only the physical symptoms, but the psychological, social, environmental aspects while addressing the survivors and families' needs and priorities. OT services can promote independence, improve function and adaptation in the survivors, and can even reduce caregiver burden and improve caregiver well-being. You must acquire a doctor's referral and have health insurance coverage to start OT services, but it's also important to advocate for your loved one's needs. We hope you found this webinar helpful and you have an increased knowledge of services that can assist you and your loved one during the brain injury recovery process. So the resources we provided in the webinar are just a small part of the resources we have included in our free comprehensive resource guide. We will send you the completed resource guide in the coming month as we're in the middle of finalizing it, and it'll be available online for you to access at any time on the Neuropractice website. Now we kindly ask that you take our second survey to measure how effective we were in providing you helpful information. There it is. I think you mentioned you have a caregiver support group. Is that in person or virtual? Our support group is online only at the moment. You can actually access the information on our website. We do also record the modules and we post them on the Neuropractice Caregiver YouTube page and then on the actual website. It's on Thursdays from 6 to 7 p.m. Okay, I see that we have somebody that their son is recovering from a TBI. I hope that we were able to answer some questions and give you some insight of what we can do. We did focus this webinar on how OT can focus on caregivers, but OT does address a lot of factors with TBI survivors of all ages. We do neuromuscular re-education. We can also, if they're more of an advanced in their recovery, we can work on going back to school, gaining employment, even making sure that they have accommodations in school. So whether that be high school or middle school, elementary school as well. Okay, go back to work, I see. Okay, so we definitely do have resources for that. If you're in the California area, I do have a list of vocational programs that are, some of them are focused in brain injury survivors and helps with social skills, getting a resume together. They even do practice interviews and other aspects like that, but I can send you that information. Yes, and then the Department of Rehabilitation does provide services for getting back into work, especially for TBI survivors. Okay, and then also an update by Christine. We'll be creating an educational series for brain injury via YouTube, and that's going to be launched within the middle of March, and that's going to be free. So you can access that on, so if you go to YouTube, you can subscribe to the Neuropractice YouTube page, and then they'll actually host all of that information, and then you can get notifications when they update it. You just have to select receive notifications from the YouTube page. Good, I'm glad the session was good. Definitely you're gonna provide more resources in the future. In the meantime, we do have caregiver resources on our webpage. So it's gonna be www.neuropracticerehab.com/caregiver. And then again, we host it on our YouTube page. So you can find the modules. We have a Reddit and we have a Facebook. So it's gonna be Neuropraxis Family and Friends of TBI Survivor Support Group. It's a private group, so you can ask to join. And then we also have our Reddit page, which is TBI Caregiver Support. The Reddit group that we have is public, so you can also share it with friends, family members that they would, if they're looking for support. We do post information every week. We're pretty active on both of them. Yes, definitely reach out if you have questions. You can email Neuropractice directly at hello@neuropracticerehab.com. Yes, so it would be the hello. So if you're asking about Neuropractice services, they do serve individuals who are 13 years and older, and they also see TBI and spinal cord injury. Thank you so much for giving us your time and allowing us to provide you this information.